This is a recording of the inaugural National Town Hall on Preparing and Responding to Mass Violence, presented by the National Mass Violence Victimization Resource Center in collaboration with the U.S. Department of Justice Office for Victims of Crime and the OVC Training and Technical Assistance Center. And now your host, Dr. Alyssa Reingold.
Our center is grateful to the United States Department of Justice Office for Victims of Crime for its ongoing support of our efforts and of this town hall today. Our learning objectives today, hopefully you're going to learn a lot of different resources that are available from our center as well as from OVC TTAC and how our services differ and complement one another. Both entities are sponsored with support from the Office of Victims of Crime, and you're going to hear a little bit about the Office of Victims of Crime from Eugenia Pedley. Hopefully, we won't overwhelm you with too many resources that we will share with you today, and then we'll also help describe how you can request technical assistance from both of our centers. So I just wanted to orient you a little bit to our presenters today. First, we are going to welcome Eugenia Pedley, who is the Program Manager for the Mass Violence and Terrorism at the Office of Victims of Crime, OVC, within the U.S. Department of Justice. Since joining OVC in June 2012, Ms. Pedley has worked with communities and organizations across the country, such as Pittsburgh, Las Vegas, San Bernardino, Newtown, and Boston, that request anti-terrorism and emergency assistance program, or AEAP, funding to support victims of these incidents. Eugenia provides guidance on grant development, technical assistance on victim support programs, and grant monitoring. She's led the development of the Helping Victims of Mass Violence and Terrorism toolkit, which you'll hear a little bit more about today. And she manages a number of mass violence awards and programs that work to prepare for and respond to these incidents. Ms. Pedley has a background in law enforcement intelligence, working for the FBI and other federal agencies prior to joining OVC. After Ms. Pedley speaks, we're going to have Ms. Mary Vale Ware present. Mary Vale is responsible for the U.S. Department of Justice for Victims of Crime Training and Technical Assistance Center, or OVC TTAC, the Improving Community Responses to Mass Violence Project, the International Terrorism Victim Expense Reimbursement Program, and the Vicarious Trauma Response Initiative. Mary Vale Ware, OVC TTAC Project Director, has more than 29 years of experience in victim services, including 20 years specifically in mass violence response. She's responded to mass violence incidents including Virginia Tech, 9/11, Orlando, Las Vegas, Virginia Beach, and more recently, Rigby, Indianapolis, and Oxford, Michigan. And then I will follow Mary Vale and talk a little bit about the Mass Violence Center. So, without further ado, it's my pleasure to introduce Eugenia Pedley, our center's program manager and senior program manager at OVC.
Thank you so much, Alyssa. Good afternoon, everybody, and I'm really glad that you can join us today. I realize that some folks may not know about OVC, so let's start off with a little bit of information. For those of you who aren't aware, in 1984, Congress established the Office for Victims of Crime under the U.S. Department of Justice through an amendment to the Victims of Crime Act known as VOCA. An important element of our mission is to respond to mass violence and terrorism, and we do this primarily through the Anti-Terrorism and Emergency Assistance Program called AEAP. So every year, OVC can access funding from the emergency reserve that's available beyond the appropriation cap that Congress establishes for the Crime Victims Fund. AEAP is more than just grants, and it includes things like funding for training and technical assistance, our International Terrorism Victim Expense Reimbursement Program called ITVRB, and various mass violence interagency agreements that we support with this funding. So AEAP grants are designed to help victims of mass violence and terrorism in areas that have really been overwhelmed after these events by supplementing existing resources. I should note that grants are available only for organizations and not for individuals. So I've put a link on the slide that will take you to the AEAP webpage, and I think that somebody from the Mass Violence Center here is going to be putting the link in the chat box. So for those of you who are interested, if you click into that after the presentation, of course, there's a video that talks about the program, and I think it has some really good interviews in it. It's a few years old at this point, but it's still really relevant. AEAP grants can provide supplemental funding to jurisdictions after a mass violence incident when existing resources are not able to meet victims' needs. And because of this, whether we use AEAP grants or not really depends on a jurisdiction's ability to help the victims of the incident while not negatively affecting victims of other crimes. So a really big, densely populated city with a lot of resources may not need AEAP funds, while maybe a smaller area does, although certainly we've had some large jurisdictions that still require help. So there are 4 types of grants under AEAP, and one is crisis response, and that really helps in the initial aftermath of an event. There's consequence management to really help victims kind of adapt and restore their equilibrium at least a little bit. Criminal justice support helps victims participate in investigations and prosecution. And then there's crime victim compensation to reimburse victims for supplemental out-of-pocket expenses. The good news is that grants are retroactive back to the date of the incident. And generally speaking, we combine any one of these types that you see on your slide here into one application. And that really helps us cut down on the administrative burden. And it also ensures that expenses are not duplicated in multiple grant applications. So I've listed some allowable services that are funded under these grants, but this is not a comprehensive list, just kind of a sampling of things that we sometimes fund. And items can include compensation for various incident-related expenses, some typical mental health interventions like counseling, and also some emergency expenses are supported. Also, grants can fund things like child and dependent care or physical and vocational rehabilitation, and help maybe even intervene with employers or creditors if that's something that's needed, because sometimes victims become incapacitated, and that becomes an issue. There can also be support for victims to participate in the criminal justice proceedings, and maybe there's not enough room in the courtroom, so we might fund things like closed circuit television for remote viewing. And then there's also things like victim outreach and notification systems, and that can even include victim informational websites. And again, it's important to remember that AEAP is a supplemental grant program, and that really means it can pay for things over and above typical expenses, but it's not intended to supplant existing resources. So for example, it can pay for additional counseling space, but not existing counseling space. So I'd like to take a moment to mention something that's a bit unusual that we sometimes fund under these grants, and that's something called a resiliency center. And these centers can create a single point of entry for victims to access needed services, but I want to note that they're not the only way to get services. So in addition to housing what we call navigators, which are really points of contact for victims to help them navigate what's available to them, these centers can also provide a range of services on site or connect victims to external services. So resiliency centers might include things like victim advocacy and navigation support for things like housing and education, legal, medical, and financial service referrals. There can sometimes be on-site mental health counseling and therapeutic services for survivors and their families. And that can even include some things that you might not think of, like maybe recovery support, perhaps tips for coping with the holidays, maybe how PTSD can affect relationships and things like that. Some of these resiliency centers can do teletherapy, which can be provided in victims' homes, and that's particularly helpful for incapacitated victims or those perhaps from out of state. And we also sometimes put in things like a website that is a way to get information to victims of an incident, and sometimes it's a safe space for victims to connect with each other online. So we really do understand that these crimes are overwhelming to communities. The process of these grants is not fast, and it takes many, many months. And that's why we really offer support and free training and technical assistance consultants to help communities and organizations through this process. The consultants can do many victim-related activities, like identifying resources, assessing needs. They can facilitate meetings to bring likely service providers together to establish what those needs are. They can develop strategies for responding to an event, and they can even draft the grants themselves, which really helps organizations because we know that they're kind of an institutional victim sometimes. So because AEAP grants are supplemental, we have to determine what states and localities can reasonably fund while still helping victims of other crimes, and that, again, can take some time. So there's a lot of engagement that goes on over a period of many months as victims' needs evolve and continue to be identified, and consultants determine the capacity of existing resources or the need for new support if it doesn't exist in the community. And I typically look at expenses to see what can and cannot be covered under these grants, and I often do this in conjunction with our reviewing attorneys. So if one of these events happens in your area, please be patient because it is a time-intensive and complex process, but the support to victims is important and will be worth it. And now I'll send it over to Mary Vale.
Hi, everyone. I hope you're well. It is nice to virtually see so many of you online. Again, I'm Mary Vale Ware. I'm the project director for the Office for Victims of Crime Training and Technical Assistance Center. So just a little about OVC TTAC. And before I say that, I always like to start with thanking you all for what you do every day for your communities. I see a lot of folks in here who are victim advocates, a lot of folks in the criminal justice system, and every day on a good day, you're promoting resiliency and healing in your community, and really, in some cases, being a violence disruptor. And I know that is a big burden to carry. And I just want to say thank you for doing that if nobody has thanked you today. So thank you so much for all that you do for the people in your community. It is so badly needed. So with that, let's talk about resources so you don't have to carry everything on your own all the time. If you're not familiar with OVC TTAC, we're the gateway to training and technical assistance for victim service providers, allied professionals, all kinds of organizations, really anybody who touches crime victims. OVC created us many, many years ago in order to support the field and increase capacity to serve crime victims for all victim serving organizations. All right, here's some ways. I mean, there are a lot of resources. If you go take yourself to the OVC TTAC website, some of you might be familiar with our modular training, victim assistance training online. It's pretty easy modules to follow. We have our National Victim Academy that teaches everything from how to develop your board to strategic planning to building a trauma-informed organization. And then you can have customized training and technical assistance for whatever your specific issue is. You can just call us. So those are some of the ways that we can help you. We can even do deeper dives that are a little bit longer in terms of engagement, like helping you with your strategic plan or your evaluation plan or any of those kinds of things, looking at your policies and procedures, providing basic training, all the good stuff. But what we're here to talk about today is mass violence, and that is also one of our tasks at OVC TTAC, which is to respond to incidents, and I'll talk a little bit more about that later, and to also give either just-in-time training and technical assistance or training and technical assistance just generally to your community around mass violence. So here are some ways that OVC TTAC gives mass violence resources, and sometimes it's at the request of OVC in the wake of an incident. Sometimes it's at the request of a community who's trying to develop a basic, some basic knowledge around mass violence, basic planning, facilitating meetings, that sort of thing, like Eugenia talked about. If you have a mass violence incident, then you will be contacted by Eugenia Pedley probably. Or your VOCA administrator will be your Victim of Crime Act administrator who oversees those funds in your state would be contacted to offer support. And if that support is needed in your community, you would be matched with consultants. We do have a consultant pool that has responded to multiple mass violence incidents over the years across the country. And they are quite good at what they do. And so that's one way we can support you after a mass violence incident, is to give you some folks to help you think about best practices, what might happen next week, the week after that, a year from now, 2 years from now. They can also assist with needs assessment, writing the grant, service mapping, all of those sorts of practical things that need to happen in a community in the wake of a mass violence incident. We also do training around the mass violence toolkit. I think the link is going to be in your chat. And so that is something else, or teach you even how to use the toolkit or look at the toolkit in terms of your planning and preparation. Sometimes people aren't looking at the toolkit until after they have an incident, and that's okay too. We're not judging that. We're just going to help you as we can. We have a web page on TTAC that has a number of mass violence resources. I'll show you that in a second. It also has a training series. And like I said, just customized, generalized training and technical assistance around mass violence if you need it, from the folks in the field who do this pretty regularly and with excellence. So how do I get all these great things? Either if you have experienced a mass violence incident, as I said, the Office for Victims of Crime will probably contact your VOCA administrator and say, do you need support? If the answer is yes, OVC will reach out to us and request consultant support. And then we will work with OVC to find the right consultant for the response. And I talked a little bit already about the kinds of things they can do. And they do, depending on the incident and the level of support that's needed by the community, they do stay with the community for quite some time. They may arrive in close proximity to the incident, which is our preference, because then we can be more helpful to communities in thinking about their response if we get in a little bit early, but later is okay also. And usually we stick with the community as they're doing their service mapping, determining what kind of resources they need, determining if they need some just-in-time training or technical assistance for large or small groups of people, and all the way through a grant if that's what needs to happen. These are examples of some of the communities that we're supporting. Current ones are highlighted in yellow, unfortunately. So we do have a great view into best practices that have worked across the country. And of course, every community is different, but we can help people think about what might work in their communities that have worked in other communities as well. So that is some knowledge that we bring to the table for your community in the wake of mass violence. Here's just an example of the toolkit. And again, I think that link is going to be in your chat. It's really easy to Google OVC Mass Violence Toolkit. Oh, hi. Hi, Oxford. So it's really easy to Google the toolkit. And my number one tip on the toolkit, y'all can hear it here first. Hopefully you don't have to hear it in the wake of a mass violence incident, is go to the checklist. Look at it, see what's missing, see what your community has available in the checklist. There's a response and recovery checklist. They're wonderful. They will help you identify gaps. If you want to just take a look at that and maybe get a jump on response, that would be a great way to do that. So in terms of the toolkit, it is built for loads of different professionals to use it. Even though the toolkit was sponsored by the Office for Victims of Crime and OVC TTAC does a lot of work around the toolkit, we do use that framework with emergency managers and state and city government officials and law enforcement officials, because it just provides a handy dandy framework for planning and response. So loads of people can find some value in the toolkit. And again, I like the cheat of going to the questionnaires first, the checklists, because then it tells you where you need to go for the next resource. It's a nice roadmap for folks. This is just a quick visual of our mass violence and terrorism webpage on OVCT TAC and all the links that are available for you. We do have a webinar series that's associated with the toolkit. So if you wanted to explore more about donation management, for example, here it comes. If you wanted to explore more about donation management, you know, there's a webinar for that. If you want to learn more about commemorations, there's a webinar for that. So there's some webinars available to help expand on the topics that are contained in the toolkit. And those are conducted by folks that we have used in response who have done quite a bit of work on this over the years across the country. Here's an example too of some of the work that has come out of our technical assistance with communities. So actually this came from some work I did with Chattanooga, Tennessee. They wanted some introductory training on mass violence for their city leaders and why they should be prepared and what they should be thinking about. And so we did a training for them. And one of the things the police chief said to me, as I understand, there's lots of, you know, the FBI has done death notification guidance, and I think Penn State was part of that, but we don't have that much homicide in our city, and it would be great if our officers had something they could watch quickly in their cars. And so we, based on those wonderful resources and some others, and also our expert, subject matter experts, we developed a very easy micro-learning video on death notification that is really aimed at people who may have to deliver death notification. And so that's one example of when we provide TA and we hear a problem, we try to go back and solve it so that it can, not completely solve it, but put it in a way that people can access it across the country. So here is the mass violence webpage again on OVCT TAC, and you can see it's pretty easy to click through and find the resources that you need. I'm not going to spend a lot of time on that. I just wanted to show you the visuals so you can navigate there if you need to. And here are some of the webinars that we have produced in order to help with some of the topics, to go in depth on some of the topics in the mass violence toolkit. You know, and so these are all webinars we develop because these are issues that we have seen communities struggle with over time. And so we wanted to amplify some of the topics in the toolkit and developed webinars around those with our subject matter experts. And those are here and available for you. You can watch them at any time. So how do I get all this good stuff? Not just by going to the web. Again, we will do customized training for your community or your organization if that's what you need. We will just do an initial consultation if you want to talk about what's involved in mass violence response and planning. As Eugenia said, one of the things we do that seems small but ends up being big is facilitating meetings of people, particularly in communities that don't normally work together, right? Emergency management often deals with natural disasters as opposed to mass shootings, for example. And they're not familiar with victim advocates in the way that maybe folks in the criminal justice system are. So we will facilitate meetings bringing all the interested parties together, either before or after a mass violence incident, to help them think about how they might work together and leverage each other's resources in a response. We do help communities with protocol development and thinking about how they want to respond and who will respond and where and when, so they are prepared if something happens in their community. And we will also follow up. So we've had communities where we help them with protocols and then they want to refresh them. Something has changed, personnel has changed, funding has changed, a structure has changed, and they'd like a follow-up consultation. Or they got basic mass violence response training, they would like something a little bit more in depth now for a specific group. And so we will follow up with those communities on what they need to help grow their response plan. And again, super easy to ask for help. It's a quick email. Someone will call you, you'll get a call back. We'll talk about your needs, and then we will develop something in order to give you the support that you need to continue your work. All right, I'm going to hand it over to Dr. Reingold. And again, thank you all for all that you do for the field and for your communities. And call us sometime and let us help you.
Thank you, Mary Vale. Appreciate it. I appreciate the work that you and your team have been doing over the years. I'm going to be talking a little bit in an overview about the work at the National Mass Violence Victimization Resource Center and some of our resources that we currently have available, as well as give you a sneak peek about some that are upcoming. So the National Mass Violence Victimization Resource Center was established in October of 2017 in partnership with the Office for Victims of Crime, or OVC, within the Office of Justice Programs. And the center is comprised of a multidisciplinary team of scholars, of researchers, as well as in the field victim assistance professionals, mental health professionals in the area of trauma and traumatic loss, partnering organizations, and some technical assistance, some technical experts, as well as relevant local and national organizations to kind of create this multifaceted team of, that collaborates with OVC. So our efforts, or everything we do at our center, is survivor-driven and trauma-informed. We recognize that impacted communities are unique to where the mass violence incident occurs, their geography, their size, and their capacity to collectively and collaboratively respond to mass violence incidents. We also know that communities have diverse cultures, races, genders, ethnicities, and that mass violence motivated by hate are often targeted against specific faiths, cultures, and genders. And so while most of our resources we develop are relevant to all mass violence incidents, we also offer many that are specific to unique populations that are directly affected. So 4 times a year, our diverse and highly experienced stakeholders forum meets to review our center activities. Our stakeholders forum gives us their input on recommendations for needed resources in the field. In between meetings, they review our new materials to offer their input, to review some of our new materials, check out our website, and just give us feedback from along the way. After a mass violence incident occurs, AAP funding from OVCs help communities to establish long-term resiliency centers, as Eugenia had mentioned, and we facilitate an amazing monthly meeting of both center directors and center administrators to identify and address their singular and collective needs. As a group, we discuss strategy planning and sustainability planning. We talk about policy and program development and program evaluation, and just as a way for these directors to kind of share lessons learned and the challenges they face. Often some of the ideas and challenges that are brought up in that forum then also helps our center create new resources that may be needed. And since many grassroots efforts that follow mass violence incidents are led by survivor-driven NGOs, we have a brand new forum that actually just started yesterday. It was our very first meeting to help survivor-driven NGOs connect with each other in order to hopefully help better network, identify areas and challenges within these organizations that we can help facilitate and connect to resources. I just wanted to take a moment and just highlight some of our partners Our center is fortunate to have three principal national partners who represent important stakeholders in mass violence readiness, response, and resilience. Our first is the American Hospital Association. So if you visit the AHA's Hospital Against Violence webpage, you'll see that many resources we've developed specific to mass violence preparation and response for hospitals and healthcare systems. We've worked with the Hospital Association on a series of webinars specific to operations during the COVID pandemic and how to manage and prepare for mass violence. And we're currently working with them on a checklist for healthcare leaders that will be presented at a national conference for rural hospitals and healthcare systems coming up. Early on in our work, we've done a number of different initiatives with the National Governors Association. So early on, we co-sponsored a roundtable of governors' emergency management agency leaders. We're able to educate them about the vital roles of victim service professionals, and we continue to work with them on effective communication and messaging related to mass violence incidents. We also work with the U.S. Conference for Mayors, and we've contributed to their new playbook that helps mayors prepare for and sensitively respond to mass violence incidents, as well as include helpful information about victim assistance resources that they may or may not be aware exist in their community. We plan to hold future roundtables with mayors who have experienced mass violence in their communities to create some lessons learned, especially to help leaders better manage and take care of their needs and while they're taking care of those that they're serving. I just wanted to highlight that we've also partnered in the past with the Police Executives Research Forum, with UCLA, with Unified Solutions Tribal Community Development Group, the DART Center for Journalism and Trauma, Boston University School of Public Health, just to name a few of some of our other partners. All right, so I wanted to talk if you haven't visited our website, please do. We have a wide variety of information and resources for victims and survivors, information for first responders, for mental health and behavioral health professionals, for civic and community leaders, and media professionals as well. And our center has a robust presence on the web. So in addition to our website, we publish a quarterly newsletter and host a monthly topical podcast. So I believe in the chat box, you'll get a link. If you are interested in signing up for a quarterly newsletter, you can. And you can, on our website, peruse our past newsletters that we've distributed. We have a really great podcast that you can subscribe to on Apple Podcasts, Spotify, or Stitcher Radio. And we have wonderful interviews with folks in the field. We also have a presence on Facebook, Twitter, Instagram, and encourage you to follow us there for any updates on our new tip sheets we create, on our podcast information. We also provide information about commemorations of those who have died because of mass violence. So if you do go to our website, you'll see that we have a good number of tip sheets that we've developed over the past number of years. And early on, we learned from all of our stakeholders, and I see some familiar names actually here to some of you, that information about mass violence incidents was necessary, but also needed in kind of concise, easy to understand formats. So our tip sheets and guides are evidence-informed, field-driven. So if you review the tip sheets and identify a topic that's missing, let us know. That's how we've sort of developed these tip sheets, basically from hearing back from our communities and our constituents of, hey, I couldn't find this resource. Where is it? And we'll go look in the field and see if we can find it. And if we can't find it out there elsewhere, we'll create it. Our tip sheets, we're not trying to reinvent the wheel. So also on our website, if there are resources out there that cover certain topics, we'll make sure we highlight that on our webpage as well. I just wanted to highlight a few. We've got a lot of resources on our website, but I wanted to highlight a few specific publications that may be relevant to some of you. We've created we first did a review of mass violence after action reports. We know that many communities in the aftermath of mass violence do a very thorough after action report to kind of look at lessons learned so that others can learn from their experiences. And what we did is we kind of did a review of the scope and content of existing after action reports to better understand the potential areas and improvement to those reports, but especially as it relates to both victim and mental health and behavioral health services. So we have that document, which just provides the overall review of past reports, and we use that then to guide recommendations for communities that are going to be doing after action reports as recommendations as it relates to victim and mental health services, and we provide a brief template for folks to consider. We know there's some other after action report templates that are out there that are fantastic. Again, this is not to replace those, but really to offer some food for thought as it relates to considering victim needs in those reports. And then the third document I wanted to highlight here, which I know we received a little bit of feedback or questions about information that could be helpful for law enforcement. So in collaboration with Police Executive Research Forum, or PERF, they, in partnership with us, identified lessons learned by police executives who have experienced a mass violence incident in their jurisdiction. So it provides some overview of some specific kind of case studies and lessons learned from some specific communities. Our center has compiled a compendium of existing and adapting resources for victim service professionals, mental health behavioral professionals, first responders, emergency management professionals, and just community leaders that address readiness, response, and resilience relative to mass violence incidents. So this compendium includes 26 modules that feature written and audiovisual resources, as well as connects to 2 trainings that may exist in those topic areas. So our intent in this core compendium is not to duplicate existing training resources, such as some of the wonderful training resources that Maribel talked about that OVC TTAC provides. This is not to replace the toolkit, but really is to have a compendium to sort of share a compilation of the existing resources that are out there, offer an array of training opportunities that complement existing content, especially that's specific to behavioral and mental health needs, and then provide information about other training resources that may be needed. So we will work with individuals, requesters that are interested in learning about specific areas of interest for their audiences, and we'll help them develop what their learning objectives may be, and then either connect them with folks in the field, like at OVC TTAC, if they have those topics already available, to connect them to them to be able to provide those types of trainings, or if it's relevant to some of the work that we're doing around behavioral health, we may work with communities around doing some learning activities around those topics. So I just wanted to highlight one of our bigger sort of resources that we've rolled out. We've rolled out a new self-help app that's specific to mass violence incidents. So this app includes education about the impact of trauma and grief and walks victims through learning several coping strategies. It's called Transcend, and you can find it on both Apple Store and Google Play under what's called Transcend NMVC, and it provides written explanations, active exercises, videos that highlight strategies to help individuals cope with stress and some common mental health difficulties that many victims and survivors may experience after mass violence. This is free. It's open to all community members. It actually potentially could be even some of the same skill sets can be very helpful for even victim service professionals and those that may be experiencing secondary trauma responses as a result of a mass violence incident. So it could be helpful for us to also be able to help ourselves. And so we've got some components on how teaching how to calm your body, how to ease your mind, how to cope with loss if somebody lost a loved one, how to find help in your community as well. So I highly encourage you to check it out and download it. As I mentioned already, we've started a podcast series where various professionals in the field, ranging from public health researchers to victim service providers to mental health clinicians and survivors, and they're interviewed about their thoughts about mass violence, its impact and response. And so this is just a snapshot of some of our more recent podcasts that we've done. So in October, exploring the connection between domestic violence and mass violence with Lisa Geller. November, we had hate crimes and mass violence with Georgia State Senator Dr. Michelle Au. So we have some different folks from across the country we've interviewed. Please check it out. It's been quite informative to kind of hear different perspectives. I just wanted to highlight a couple resources that we're itching to be able to get out to you all soon. So you'll be hearing from us soon. So one of which is a guidebook that we've been working on for a good little while with the U.S. Attorney of South Carolina's office. It's a planning and implementation guide for comprehensive coordinated victim assistance for mass violence incident trials. So this has really been a labor of love for us over the past year between our center and the South Carolina Acting U.S. Attorney's office, with support from OVC and Department of Justice. And it's a guide that's really designed to help not only prosecutors, but victim service and mental health providers and other sort of professionals to plan for high-profile trials with a focus on victim and survivors' needs. It's a 96-page guide. It's very survivor-centric and based on best practices that we sort of derive from pulling a number of previous trials that involved defendants that were charged with either federal or state crimes. So we're excited, and I do have to say, I got news a little bit yesterday that I actually think this might be being released, hopefully this week, if not next week. So be on the lookout. We'll notify you all when it comes out. Eugenia noted earlier about the AEAP program that supports jurisdictions that have experienced incidents of terrorism and criminal mass violence incidents. And we've been working closely with her and her office on developing an online template to be able to help communities plan and submit their applications for AEAP support. This template does not replace the actual application process that you need to go through and the uploading of information, but it's really meant to be kind of a tool that can sort of help communities understand what the scope of AEAP funding may provide, help you organize your information to be able to create your narrative for that application. So we're excited to get that out to the community this coming year. In addition, we have in the process of developing what we're calling a virtual resiliency center. And so really what we're trying to do is provide an online centralized resources to help professionals and communities create and strengthen either individual as well as their collective resiliency in the aftermath of mass violence. So, we heard from a number of our stakeholders that our resources online are great for different areas, but where is a place that they can go that as a victim or a survivor or family member, that they can get kind of a whole host of resources, especially while their community is currently working on establishing a resiliency center, which may take some time. So where can they get some of that information early on? Or maybe it's a victim or survivor that doesn't live in the community where the event occurred. They live somewhere else and might not have direct access to some of the resources in that community. Where can they go? And so we are right now in the process of developing that website. There'll be 4 areas of focus: managing trauma and grief, victim and survivor resources, personal health and wellness, and connection and support. So that is coming soon. We also, when a mass violence incident occurs, we are not direct responders. We don't provide direct services. However, we kind of work closely with OVC in connecting people to resources if they need it. We respond to inquiries for support and technical assistance from some local and state stakeholders upon request. We provide some curated resource pages that kind of coalesce some information and resources that might be helpful, that's specific to that incident, that we try to get out either in social media as well as to kind of our media contacts in those areas. So in the aftermath, when we learn of the mass violence incident occurs, like as I mentioned, we customize sort of a press release tip sheet that collects information either that from our tip sheets or from the ones that we know that are out in the out in the field that are good, and we share those with the community. We share those with the U.S. Conference of Mayors, which then shares them with their mayor constituents, with the National Governors Association, which shares it with their constituents, and the Hospital Association. So it's kind of a nice way to kind of get similar information out in a variety of ways. We also send this resource page of information to the Congress member in whose district that mass violence occurs from the U.S. Congressional Crime Survivors and Justice Caucus. So feel free to follow our social media so that way you can also access some of that information. I just want to highlight a little bit that really our bread and butter is our focus on our behavioral and mental health areas. A number of our faculty within our National Mass Violence Center are clinical psychologists or master's level clinicians that are both researchers and frontline in the field clinicians that have been providing uniquely not just mental health services, but specialize in trauma, which is a unique specialization in the mental health field. And so we've got a good number of team members that really have some strong experience in working with victims of crime who've been experienced either trauma or traumatic loss. So we've been able to provide some mental health or behavioral health consultation to different entities to kind of help them tease apart kind of what is good evidence-based work, how to kind of find those, how to get your brokers and community folks trained in some of those evidence-based practices. We provide some consultation to resilience centers on trauma-informed strategies, assist mental health and victim service professionals in as well as in understanding kind of best practices. And then we also can provide some training around the mental health needs of victims during court proceedings. This is just an example of some of the communities that we've been able to provide some of that mental health expertise to. So I just want to quickly, I'll just make sure I keep an eye on our time. I just wanted to quickly highlight, I mentioned evidence-based mental health interventions, and there are a number of different ones out there. I just want to highlight just a few just to kind of put a little bug in your ear about some that to go check out. We may touch upon these in future, some of our future town halls when we talk about response and recovery efforts, but I just wanted to highlight a few in case you're interested. In the early stages after a mass violence incident occurs, so during those first few days, actually, there is some evidence-informed practice that volunteers, victim service professionals, other responders can be trained in to be able to help support. And right now, the gold standard or the most recommended is psychological first aid. So shortly after 9/11, a lot of providers came into New York to provide resources, to provide support, to provide treatment, counseling, whatever it may be. And it was very clear in the trauma and disaster field that there really wasn't a good best practice that all folks can kind of be doing. And there was a lot of different things that was done, some helpful, some maybe didn't do much, didn't really help or hurt, and some that might have been actually harmful to individuals. So folks in the field, from experts and providers in the field from the National Child Traumatic Stress Network and the National Center for PTSD got together and said, what do we know from the literature that we think could be most helpful to help encourage people on that process of resilience and recovery after a large-scale event, and hence how psychological first aid or PFA was developed. PFA is really only supposed to be provided in the first 24 to 72 hours after an incident. However, those same experts kind of got together and said, okay, we can do something in the first 24, 72 hours. We know that there's good evidence-based treatments down the road if somebody experiences long-term difficulties. Can we do anything in the middle? What can we do to help foster and support that recovery? Humans are resilient, and there are things that we can do to foster that. And what could that be? And so they looked at the literature and looked at what they think is sort of evidence-informed early intervention approaches, and sort of developed skills for psychological recovery, or SPR. SPR is not a therapy. It's not treatment. This is actually something that victim service professionals in the field can be trained on to be able to implement and work with their victims in their communities. So those are just some 2 early intervention strategies. PFA is usually in the first few days, SPR is in the several weeks or months following a mass violence incident. It includes a number of different kind of skill sets. There is training on both of these, and you can check out their websites at the National Child Traumatic Stress Network and the National Center for PTSD to learn more. Their manuals are downloadable. We're actually in the process of working with our colleagues in developing a PFA and SPR manual that's specific to victims in crime and mass violence. And so hopefully that will be coming out within the next year. And we can also provide some technical assistance if need be around these evidence-informed services. And lastly, I just want to, of interventions, just want to highlight some evidence-based trauma treatments. In the mental health world, there's a lot of treatments that are out there, and there's a lot of really good stuff. There's a lot of stuff that people enjoy and like doing, and then there's some that we don't know if it's going to help or hurt individuals. The good news is there's a lot of good research in the trauma field of what we know can really help people recover if they develop ongoing difficulties like PTSD or depression. And so there are some really good evidence-based trauma treatments out there. This is not an exhaustive list. This is just several: prolonged exposure therapy, cognitive processing therapy, EMDR, complicated grief therapy, grief approach, and trauma-focused cognitive behavioral therapy, just to name a few. And so those are some good evidence-based treatments that are out there. Our center can help connect communities that want to get trained in some of these specific treatment packages. Either we can help facilitate training ourselves, or we can connect you to some experts in the field that can help provide training to clinicians in your community on these evidence-based treatments. And one of the last things that we were doing at our center, so I talked a little bit about some of the training things that we can provide, our resources, our response efforts. And then one of the last things that we've been really working on in the past few years, and hopefully will continue, is needs assessment in communities to really better understand the impact of mass violence, both on survivors and victims, but community members at large. So we have conducted several different surveys. I know I saw on the chat that I think there is a few folks here from Flint, Michigan. We did conduct a survey of Flint residents in the aftermath of the Flint water crisis. We conducted a community survey that focused on residents' perceptions of exposure, on the prevalence of PTSD and depression, and risk and protective factors related to PTSD and depression. So we weren't assessing necessarily the physical impact, but more the psychological impact of that water crisis. And we also kind of looked at what type of services people received or perhaps didn't receive. And we've been working with our stakeholder forum member, Yvonne Lewis, who presented findings in virtual forums in Michigan to academics as well as researchers and to the community members. So you can access our takeaway summary of that survey on our website. And if you have more questions about that, you can reach out to us. In addition, we have been conducting a needs assessment in several different communities that have been impacted by mass violence. These surveys, we know that there's some research that really looks at the impact directly on victims and family members, but what is the impact on the communities at large? So that was sort of the goal of these surveys. So we've currently sampled over 2,000 adults in the communities of El Paso, Parkland, and Pittsburgh, to identify the impact these events may have on individuals' post-traumatic stress symptoms, depression, and other factors that really may impact these sort of difficulties. So we're looking at factors like prior victimization or social support as a potential buffer. Right now, this study is ongoing. We hope to do a little bit more in-depth analysis of our current sample, as well as we're looking to survey several additional communities in the next few years. So be on the lookout for some of that information. We do have on our website just a quick overview of some of our initial findings. And then lastly, we also are looking at the impact of mass violence on specific victim populations. And so we are currently in the process of conducting a Las Vegas survivor survey that we're conducted this past year in partnership with the Vegas Strong Resiliency Center. We've so far collected information from 177 survivor participants. Data analysis is currently underway, so you can be on the lookout for the results of that. All right. So at this point, I just wanted to highlight, if you are interested in getting any consultation or technical assistance, this is our contact information as well as OVC TTAC's information. You can email us. There are times if you contact us and it seems like, that's a better fit for OVC TTAC, I may direct you over to Mary Vale for resources and vice versa. So, but here's both of our contact information, and I am at this point going to pass it over to Aurelia.
Wow, that was really good. There's so much information and so much work that's being done in this field. And I hope that you could get a sense of it as you listen today to our three wonderful presenters. And they probably only gave you a little bit, the tip of the iceberg about the kind of work that's being done to address these issues in our community. So thank you so much, Eugenia. Thank you, Mary Vale. And thank you, Lisa, for your presentations today. Been very, very helpful and very informative. We asked when you register that you would submit questions. And so what we've done is we've selected some of those questions that kind of are representative of the many questions that came in. And so I'm going to just field those right now to our presenters, if you will, okay? The first question that came in, someone wanted to talk and learn more about the issues of donations and distributions. And we think, Mary Vale, you might be able to help with that.
I'm very sorry. This is a topic near and dear to my heart because donations after an incident can really overwhelm a community. I call it almost a little bit of a secondary crisis. So it is important to try and think about how you might handle that in advance. And look, if you start doing that, you can definitely think about how that could happen in any incident, obviously. But there is in the toolkit some information about donation management, and there's a great webinar on OVC TTAC on donation management. And there are also groups. There are state-based groups that will do donation management in the aftermath, particularly funding management. If donations are coming in for victims and survivors, there are some that are state-based, like in Colorado, or there's the National Compassion Fund that does that at a national level, but there are lots of them out there. But it's definitely something to think about and plan for in advance, because it certainly can divert your attention in the wake of a mass violence incident. So thanks for thinking about that.
Yeah, Mary Vale, I'm also hearing you as you talk that there's a distinction between a financial donation and a tangible donation. So if you're sending funds, there's a way to do that that's secure and safe, as well as there's a way, it's only so far, it's only so many teddy bears that you can use.
Yes, right.
Those kinds of things. There's only so many of those things that you can use.
Yes, yeah, and having somebody running point on that in your community is really important so that folks who are doing responding can keep doing that work. But there are some tips and tricks for planning donations in the webinar in the toolkit, and if you actually wanted a customized training on donation management, we've done those too. So.
Wow.
Talk to us.
That's very good.
And people are helping us in the chat, which I always like to see. So thank you all.
Yeah, great. Because you don't think about that until you're in it. And I had one of my staff members from my other agency said, Terry Panic said to me, do you want to do good or do you want to feel good? And so that's that kind of distinction that you have to make with some of these donations. Thank you very much. Very helpful, Mary. And thank you for those who participated in the chat. Thank you, Jeanette. Sustainability was a question that came up. And it came up because people want to talk about the sustainability of services and funding for the physical and psychological trauma after year 2 of the mass violence incident. And I think that has some particular implications. Dr. Reingold, can you help us with that?
Sure. Well, I think Eugenia Pedley provided a really good overview of AAP funding earlier, which can help offset some funding that may be needed in communities to serve victims. In addition, some jurisdictions, state level VOCA funding may be available to support the ongoing psychological needs or other state funding streams that have been used to support victims and survivors in the many years after a mass violence incident. I know that our resiliency forum, our resiliency center directors forum identified even some changes in laws and public policy in their states that they advocated for to continue funding support for long-term resiliency strategies. As well as foundation and other sort of donation support. So I think sometimes it's trying to work out different avenues to be able to fund ongoing needs. I think the question also begs the comment that mass violence can impact people for many, many years. And everybody has a different journey and course in how it impacts them. Some may only need some services early on and kind of can get connected and with their supportive loved ones move on. While others, it might be a few years down the road is the first time they reach out to get some care, and that's okay. And then hopefully communities can be able to continue to provide for those individuals. So yeah, I don't know if Eugene, if you had any other comments beyond kind of some of that as it relates to sustainability.
Yeah, actually my microphone is unmuted here. It really depends because the grants only last a certain number of years, and that varies. But in general, they're the funding years, so say FY22, and they only go 3 years beyond that at the most. So within that time, some communities have had their needs met for things like resiliency centers, maybe because of some of the services that are already in place locally, or that victims have largely had their needs met. Other times it does go on further, and so we've had some communities that have actually looked to their states and their state VOCA offices or other state funding sources and are either preparing to do that or are thinking about doing that. And I think Nevada might be one of those locations where it's looking at, how does that go on down the road? So it really is kind of individualized and it's based on the needs, but there are a variety of ways to address it.
So what I'm hearing you say is that it's kind of when you're providing the service as well as doing the work that it takes, kind of right alongside of doing the work, you're also looking at how do you keep those services going if that's what is deemed necessary for your community. So you don't just wait until after the grant is ended to start looking at sustaining your services.
Correct.
Okay. Good. All right. Thank you. All right. Here's another question. Can you talk about any options for victims and survivors who are interested in training as trauma or grief-informed peer support specialists? Maribel, I'm going to throw that at you. Can you help us?
I will try, but I also know that there's a lot of expertise on this call. So this may cause people's stomachs to drop, but we actually talked about this a little bit, and I assume survivorship because just when you look at crime statistics, you either are a victim or you know one. Unfortunately, when we look at crime as a broader subject, broader than simply mass violence. So and people want to share that in ways that work for them in ways big and small. But if one way people want to, who are survivors or victims, want to continue to work in the field, I always say first make sure you have taken care of yourself. And then, victim services as a profession, make sure you have gotten the training that you need so that you are helping and not hurting, and that you are providing a high standard of care for folks that is evidence-based, like Dr. Reingold talked about, and that you understand what that looks like and what that is, because that's really important for people who are newly victimized or new survivors. So I guess at first do no harm, but there are lots of resources, right? Like, Dr. Reingold went through a lot of resources online. And then of course at TTAC, we have that online, which is very basic information for folks who are interested in joining the victim services field. We actually have a webinar, Pathways to Victim Services, to help survivors think about how they might want to participate in the victims' rights movement. So there's all kinds of ways to get involved. Just make sure you have tools if that's what you want to do. And I don't know if Dr. Reingold wants to help me with that very inarticulate answer, but if she does, I would appreciate it.
No, I think I think we know social support is a buffer. We know peer support in general, like just getting social support from somebody that has gone through similar circumstances can be such a support. It makes you feel like you're not alone. It can give you a sense of hope that if other people have walked in similar shoes, I can too. I think that it's so important for people to connect with each other. But as Maribel kind of mentioned, you also want to make sure that as a victim and survivor, if that's something that you want to do, that you are in the best place yourself to be able to do that. So because I have worked with victims and survivors who they want to do that, they start to engage in it, and then it's difficult for them. It brings up their own trauma, brings up their own response, and so you want to make sure you're in a place that it's going to be okay for you, as well as going to be okay for the other person. That if you are providing support at that time, it's really about that other person you're providing support to. So it's just kind of being mindful of that and getting that good training and trauma informed care, I think, is important too.
Because peer support is not excuse me, Eugenia, is not therapy.
Correct. Yes.
Right. Eugenia,
were you going to say? Maryville, mentioned VAT. Did you want to explain the acronym?
Yes, it's a modular training that is on OVC TTAC. It's victim assistance training online, and I always say it's 0 to 60, right? Because it's everything from sort of the structure of the criminal justice system to gang violence. We have a small mass violence modular. It's a modular training. They're about an hour to an hour and a half. And actually, if you get 40 hours of that training, you can then apply to NOVA to be a certified victim advocate. So it is a nice baseline training for folks who are interested in the field. There's lots of great information there. So I encourage folks to check it out. There's also a module on ethics, which is very nice. So.
Very good. Okay, another question we have. What are some resources for the Hispanic community? Eugenia, can I throw that your way?
Sure. One of the things that we're very conscious of when we're developing these AEAP awards is that victims are multi-ethnic, and there are so many types of victims, and there are elder victims and people with different language needs. And so we try to make sure that some of these things are built into the grant. And if for some reason they are not when we first award it, we try to make sure that we shift the grant funding after that. And Las Vegas, the Resiliency Center there, is doing some really good work, I think, with trying to do outreach and provide services to the Hispanic community. And I believe they've translated many, many things that are available in the Resiliency Center, to Spanish. And they're not alone in this effort. And I do know other incidents, like I think it was 2012 or 2014, the Oak Creek, Wisconsin shooting at the Sikh temple up there. English was not necessarily the language that the victims preferred. So those folks there translated it into various languages that were helpful for them. So, these grants fund individual incidents. These EAP grants don't fund, broad services like that. But still, we encourage folks of these incidents where there's the need to make sure that people have appropriate language access, to the services they require.
Very good. Thank you. Okay, our last question today is the most important things that police can do for victims in the response phase. What are the most important things that police can do for victims in the response phase? And Dr. Reingold, I'm going to ask you if you'll start us off on that.
Sure. We could probably spend an entire town hall on this topic. I think there's lots of different things. The important role of law enforcement during the response phase to victims, I think, is really important. And maybe we will revisit this topic in a future town hall when we talk about different kind of response angles. I mean, off the top of my head, some of the more critical areas is for law enforcement to be sensitive in their role and how they conduct sort of victim-sensitive interviews of survivors and other witnesses. The importance of partnering with crime victims compensation programs and to help. They're an important role to help expedite those comp claims at times. So being aware of those programs and working with their own victim advocates around that. Coordinating with victim services and mental health professionals, I think, is important to make sure that it's a victim-sensitive death notification. I knew that Maribel kind of talked about some death notification training that one can get, as well as the FBI has I regret to inform you, death notification training, which I think they're in the process of making some updates to that as well. Working with victim service professionals on timely property return and how property return can be hopefully done in a trauma-informed way, I think is important to consider. And in cases where there's arrest of an alleged perpetrator, making sure that the lead investigative coordinator and support is really working with victim services to be able to communicate to victims, again, in a trauma-informed way. Also, I mentioned earlier that PERF has that lessons learned document, and so that's a resource to look at too. But I'm sure we can probably spend a lot more time talking about that. But those sort of hit the high points. I'm not sure if Eugenia or Maribel, you had any other comments on that one, but.
My comment is, law enforcement, our friends in law enforcement need to be part of the planning and thinking about this. And usually the way they think about planning is 24 to 48 hours. And sometimes in these incidents, they don't realize how long their roles will continue in response. And so it's important for them to plan, be part of their community's planning team on this, because sometimes we leave things to the emergency managers, hope they write it down and that everything goes well. But it's important for them to be part of the planning. And in the planning, I always have to throw this out there, planning for their own self-care. So minimizing the number of hours on shift, minimizing the number of days worked in a row. And typically, again, speaking in generalities here, our friends in law enforcement, when they respond to something like this, work way too many hours and way too many days in a row. and then it hurts later. And so if you can put some protocols in place prior to something happening, you can preserve your team and your staff, and folks can stay healthy and resilient, and all that good stuff. So, and that, again, like Dr. Reingold said, that's a whole nother training we can do on another day.
Yes, very good. Well, thank you so much. I think those are the main questions that kind of brought so many of the questions together. We're going to be doing this again. We're going to have these conversations again. That is our plan. And we talked about, I know Dr. Reingold, we talked about April, but we might have to shift that because of National Crime Victims' Rights Week kind of falling in there. So we're going to be announcing it, and we'll send the information out again. Is there anything you want to say about that, Dr. Reingold? Or
Sure. So our next agenda will focus more specifically on mass violence readiness. That will be our next one. And then the one after that will be more focused on response, and the one after that on recovery resilience. So hopefully we'll be able to bring in different speakers and experts across the field to be able to address some of those topics. So be on the lookout. When you submit registration, we'll send out registration for those. You can submit questions again ahead of time or other topics. We do pay attention to that, and so I know some folks offered some good topic ideas that is going to help us identify some experts in those areas.
thank you. Thank you. Again, here's the contact information for Office for Victims of Crime, Office for Victims of Crime TTAC, and the Mass Violence Victimization Resource Center. So feel free to go to those sites and you'll find a wealth of information.
And I just want to highlight that we will be sending out our PowerPoint slides to all registrants, and then we'll also be sending out an evaluation. So I hope that you can be able to give us feedback on this town hall, both on this town hall and then what information you're looking for in the future. And if you have questions, you can email us at the National Mass Violence Center.
Again, thank you all for being here today, and we look forward to being with you again soon. Thank you.
Thanks,
I'd
everyone.
just like to add, we will also send out the links. All the links that you've seen in the chat will accompany our email. So if you missed it or you can't find it, we'll be sending those out to you too.
Thank you, Vicki. That's why you are in that background taking care of things. Thank you. Many thanks to our speakers once again. Thank you, Eugenia. Thank you, Mary Bell. And thank you, Dr. Alyssa Reingold.